Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Oseltamivir. Its brand name is Tamiflu. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how oseltamivir works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe oseltamivir. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does oseltamivir work? Well, oseltamivir inhibits virus neuraminidase, which affects viral particle release. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in influenza virus types A and B, and an off-label indication would be the avian flu or avian influenza. With respect to contraindications or reasons we would not be able to prescribe oseltamivir, we wouldn't give it to a patient who had a hypersensitivity to oseltamivir or any other component of the formulation. Now, what about dosing with oseltamivir? So, when treating a influenza virus type A or B, we would typically see 75 milligrams orally twice daily for 5 days. If the patient was to remain severely ill after the 5 days of treatment, they could continue therapy. If it was used for prophylaxis or preventatively, we may see 75 milligrams orally once daily for at least 10 days following exposure to infected individual, or up to 6 weeks during a community outbreak. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using oseltamivir, so I'll go over some of those here now. 8 to 10% may experience nausea, while 2 to 8% may experience vomiting. Headache may occur 2 to 17% of the time, depending on the dose and what you're using it to treat, whether it be prophylactically or for treatment. Now, some more rare but serious side effects would be hepatitis, seizure, abnormal behavior, or delirium. That's all we're going to talk about today with oseltamivir or Tamiflu. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.